have the honor of introducing our first guest expert. So, Dr. Nabil Fakih is one of Lebanon and Spain's leading facial surgeons and a recognized worldwide expert in the field of facial plastic and reconstructive surgery. He is a former vice president of the Spanish Society of Facial Plastic Surgery and vocal of aesthetics of the European Academy of Facial Plastic Surgery, and an associate member of the American Academy of Facial Plastic and Reconstructive Surgery. He is a member of honor of the Argentinian Society of and Functional Rhinoplasty and International Advisory Board in the American Journal of Cosmetic Surgery. He is devoted to furthering the field of facial plastic surgery. He has authored and co authored several scientific manuscripts and books on facial plastic and reconstructive surgery. Please help me give Dr. Fakih a warm welcome for this informal live discussion and Q&A session. Dr. Fakih, are you there? There
Hello,
you are.
Hi. Hello, Dr. Fakih.
Thank
hello
you for
everyone.
being
How's
here.
everything? How Charlie? How Sashi?
Hello.
Take it away.
It's all
Great.
yours.
So let me share my presentation. If you can only disable me to share my screen. Okay. So as they introduced you, I'm Dr. Nabil Fakih. I'm a chief department of facial plastic maxillofacial surgery and reconstructive surgery at Fakih Hospital in Lebanon. I'm half Lebanese, half Spanish, living now in between both countries. And today I'm talking about nanofat and exactly bibliographic review, some indications and surgical technique, exactly how I do it. And let's go proceed that we have different types of fat. We have macrofat, microfat, SNIF and SNIE, could be also called the SNIE as milli fat or little fat or smaller fat, if you want to say it like this to explain this. And then we have nanofat. I like to use more this terminology because for me, everything of this has a specific indication in my expertise in the face. So, and I decided to build this picture, which I really started doing this, and then my friend Angel Picorelli advanced it, and then I re-advanced it. And this is exactly summarize everything. So in macrofat, we usually use cannulas, which has big size of holes, okay? And normally these are around 2 to 3 millimeter hole size. Whereas with microfat, SNIE and nanofat, whatever we want to prepare, we first start using this cannula. I prefer the Tonard one, which has spikes in here, and it has 1 millimeter hole. As you see, normally they are 2.1/2.4 millimeter multi-perforated cannulas. And then if we want to do microfat, we inject with these types of injectors. They are 0.7, 0.9, 1.2. Whereas in macrofat, they use bigger ones, which is 1.5 to 3 millimeters. And this is how we inject microfat. We suction fat with this, we liposuction fat with this, and we inject with this. Whereas if we do want to really inject microfat with a needle, we call it SNIF, and it's sharp needle intradermal fat grafting. This was published by Dr. Tonard, and normally we inject it with 23 gauge needle. And then again, SNIE, if we really want to get SNIE, we have to first do liposuction of the fat, harvest the fat. Then we will start using 3 emulsifiers from bigger to smaller. I always say ladies first, pink first, then men's after, which is blue, and then dogs after, which is green. So this is my way of memorizing that. Should be first, next, and next. And then we inject with this same cannula. You can inject SNIE, which is emulsified fat. Also, you can inject it with 27 gauge needle. And normally we inject it in subcutaneous or deep dermis. And you can go also superficial dermis if you really want, okay? So technically nanofat, we injected intradermal and it's creating bumps. The only difference between SNIE and nanofat is after emulsifying them, we pass them by the transporter and we create nanofat. We usually inject with 27 gauge, 33 gauge needle. And this is a bit a summarize about macro, micro, SNIF, SNIE, and nanofat. Okay, so that's it, what we exactly see, in fact, in the difference in fat size. And normally nanofat does not contain any fat cell, it's only liquid. Okay, so normally also another thing I should say, that whenever we harvest, we will get technically the adipose derived, the fat cells, we will get some oil in the upper part, and we will get the fluid and the local anesthetic, and in the lower part we'll get the SVF pellet. Normally, this SVF pellet, what it contains exactly 75% of the cell count in fatty tissue. And normally, as you could see, it has also adipose-derived stem cells. But we are focusing on the adipose-derived stems that are in the upper part, in the middle part, which is the fat ones. And normally the adipose-derived stem cells represents approximately 50% of the SVF cells, and the other 50 should be there. Okay, so the fat cells will have adipocytes and will have adipose stem cells, which is nanofat, if I want to say it in another way. And these normally are the one who stimulates all these, as you could see, factors that can really give improvement in an area. Okay, so also it's very important to see, and this has been published by by these guys in 2017, is they have found that in the fat harvesting, we have high density zones and low density zone. Normally, as you could see, that fat harvest with barbed cannulas, they have seen that they contain more adipocyte cells, and normally we have more, as you could see, with barbed ones in the in these types inside these parts of the fat. So that's why in my master phase set, I have used the tulip harvester, which is really my favorite harvester for doing fat grafting, microfat and nanofat. Okay, so whenever we use this separator that it has the nanofat, all the fat cells coming from here will just get stuck in these two filters that it has, and let us only the adipose-derived stem cells go down with other substances. But we will not have any fat cells inside. I'm trying to be as much as straightforward, because many of you would be new to nanofat technology, and other could be very expertise. So I'm trying to be in the middle so everyone can understand a bit. So as you see, this is nanofat, does not contain fat cells. SNIE, which is emulsified fat, it contains some emulsified fat, and microfat, we can find fat cells in there. Great. One of the best articles, I think, in nanofat, because I'm really addicted to all this fat grafting and nanofat, is for me, he is the master. And for sure, on fat grafting, I consider there is two masters worldwide. One is as you know, Tornard, and the other one, as you know, is the master of who started everything everywhere, Cindy Coleman. And he's starting with the microfat, with the macrofat, and then with Tornard, he started working more with microfat and nanofat. And really, I like. I've seen no complication ever with microfat, like cystic formation or anything related to this. With macrofat, it can happen. And nanofat was a great change to me, because it's really so important for skin rejuvenation that it's really a new thing which we have to move on for dealing many things. So as we know that these adipose-derived stem cells, it's easy to harvest. There's no logistical problems, there's no FDA restrictions, and they can cultivate it. You can really see how, if it's cultured, you can create adipose-derived stem cells, fibroblast formation in 10 days. Also inside the microfat, macrofat, and nanofat, we will always find some adipocyte viability with this study of fluorescy, and they've seen that in the nanofat there is no adipose-derived there is no fat cells in that, but there is stem cells in that. And also they have found that there is around, in the SVF of this substance, we have around 1,000, like around 2 million, we could say, of SVF, and there's a fraction of CD34. Fraction is around 100,000. This is very important, the CD34, because I just really like to mix nanofat with microfat. I think it's the one behind the increase in the survival of microfat. Okay, and something else regarding this is the percentage they made this study. Maybe Patrick Tournard can explain more about it, but technically he found that in this study how much we have SVF CD34 and the ratio CD34 to SVF. Okay, another study published by Chaput, as you could see in 2017, it's about nanofat has a regenerative capacity, and again in 2015, another study that they have seen that the post-draft stem cells will decrease in elastosis, will create thicker reticular dermis, and will have richer microvascularization dermis, creating an enhancement in the area. Another study published also in 2019, it's about nanofat, sorry, 2018, about nanofat increased dermis thickness and neovascularization in photoage nude mouse skin. And they found that nanofat, this increase will create an increase in the dermis thickness, and this have been histologically proven. Another study is about skin rejuvenation. In 2018, they have seen that nanofat PRF is safe and is effective for skin rejuvenation. Now I'm mixing PRF membranes with nanofat for closing defects, and also I'm mixing nanofat with radiase, which is calcium hydroxyapatite, for skin collagen production, also over the nanofat. And really, I got a lot of mixtures with nanofat, which can really improve a lot what we are dealing with in helping to recover something or to improve something. So also they have seen that adipose derived stem cells in 2017 can inhibit melanocyte proliferation. So also in melasma, I'm trying indication of nanofat injection because there is a study that have found that it can really inhibit epidermal melanocytes. And in melasma, which are very difficult to treat, I push them with nanofat treatments. For burners in 2019 have been published regarding nanofat improving the quality of the burn scar, and significantly improvement was seen in all parameters of facial section for scar scale. And this is something that it's very interesting also in burnings. There's a lot of studies about hypertrophic scars. I think nanofat is like magic for scars. And I'll show you cases today how they have changed dramatically. I was so surprised about these results. And this is an article which the day I read it, I said, this is how it's possible to get this from this to this. I was a bit, I mean, we all publish studies, and sometimes you could think maybe they have done something with this. How this could you fix it with nanofat only? And this is in fact with condensed nanofat, and maybe they reduced they condensed it, and in a way they pushed it all. Also they inject maybe SNIE, some emulsified fat. And that was my mission that time when I was reading. I was a bit, how could this be possible with some condensed nanofat combined with microfat and SNIF for these cases to become from this to this? I was surprised with the results, I should tell you. And from this, I was digging more and doing nanofat and nanofat everywhere, nanofat. So, and also for wound healing, nanofat transplantation can promote diabetic foot wound healing, and said, why I don't mix nanofat with PRF and then get better results for these people. I have a hospital, we have a department of orthopedic, and we help them improve these cases. Also for in TMJ, as a maxillofacial surgeon, I can tell you that in TMJ, they have seen that there are therapeutic benefits, simplicity and safety, and lack of significant side effects and complication injecting nanofat in the TMJ. They have seen that there is reduction in pain, in clicking, and in deviation in this study published in 2018. For hair loss, still now they are under studies, which I think they may require more studies, but they have seen that various conditions of hair loss revealed as promising and potentially effective role. So the indication of nanofat is in rejuvenation, in scar, in dark circles, in hair loss. And the instruments that we need, as I said, is exactly what they have said. So I wanted to create something unique for the face. I wanted to have everything I really use for the face. I use microfat, so I need instruments for microfat. I use SNIF, so I need to have things for it. I use SNIE, so I need the emulsifiers. I use nanofat, so I need the nanofat set. And I have scars, which I need to really cut them. So this instrument that you see, it has like a tongue snake, and really very nice instrument. It's my favorite instrument. I can really can't live without this instrument. If I have a scar, I really need to cut the bands of fibrous tissue formation, and really needed to have the exact set. I wanted people to have something direct. I want to use, maybe I'm a facial surgeon, or I do body and face, but I want a set for the face, I want a set for the body finalized, and this is the set. I really included Tunard's harvester because I think it has been demonstrated that it has more capacity to have more adipocyte derived stem cells. So this is the set. As I said, it's on the table prepared, so to start any procedure. And if you really want to see how we do step by step, it's very easy. So yeah, you can really see it on the you can really see it on YouTube, and also I think in Tulip's website. This is where exactly you can find the video in YouTube or in Tulip. It's from A to Z, everything step by step, how we do the procedure. But I will go quickly through it. It's a long video. I'm just copied part of it. So we prepare the face, we put some lidocaine anesthesia, or you can do it with sedation. You find a place to harvest. Usually for nanofat, you don't need big amounts, so you really need very little amount to do nanofat for skin rejuvenation. In this patient, we're doing nanofat for skin rejuvenation. You can put some anesthesia. Try not to put too much, but this is something which I usually like to put. It really blends a bit. The patient feels a bit more comfortable. I put very little. As you know, that anesthesia concentration is very important for survival of microfat, but for nanofat, it's not too much necessary. So I start injecting the modified clean standard tumescent solution injection, and we really inject it so it can numb all the area that we really require to harvest the fat. So as you see, we're injecting inside for harvesting. So technically, maybe you can use around 6 cc's, 6 of 20 cc's for nanofat. We don't need too much exactly for injecting nanofat for the face. With 40 to 60 is more than sufficient. I think 40 cc's is also so much, and sometimes with 30 depends on the face. 30 to 40 cc's of nanofat is only sufficient to inject all the face. I'm saying maybe 60 to 80 depends, because it also has tumescent solution in them, but with 30 cc's to 40 cc's of nanofat is more than sufficient. We start harvesting. Okay, so from the area you want to harvest, remember that this area is a bit tricky. Try not to if you want to suction more, this is not the best position to harvest, because you can create a dipping in the area. Okay, it's better the flipped sideway. Okay, but since I'm just harvesting very little, I'm just showing you exactly what we do. So let me jump. After this, I really harvest, and I really take out all the tumescent solution out, because by this I can really create less bruises. I inject also tranexamic acid inside to reduce hematoma. You normally, patients are technically a bit, they don't want to see hematomas, and they don't want to get bluish effects, so we inject some tranexamic acid. I really clean all the microfat. This is microfat harvesting. Okay, till now we have only microfat. So I take out all the liquid, all the tumescent solution liquid. I throw all the tumescent solution liquid. Okay, so as you see, after doing this, I transfer them to another syringe, because I want to leave the oil in the upper part. I don't want to really have oil in my mixture. So normally the oil is in the upper part, and I aspirate inside another syringe all the microfat. After this, what I'm doing exactly is to really pass it to ringer lactate to clean the microfat. So we pass it to a ringer lactate, 50% ringer lactate, 50% the microfat, and we do with the other syringes the same thing. Okay. So remember that I'm preparing nanofat only. If I'm preparing microfat, I don't use this transporter that you have seen. I'll be using the decanter transporter. I'm using this transporter, reducing the fat size, but no worries, because I'm planning to do nanofat. Okay, so then I decant again, and I clean all the this fat that you have here. Okay, So, and then here we have collecting all the microfat for really change them to SNIE. So now I will emulsify the fat. To emulsify the fat, so I'm changing now from microfat to SNIE because I'm emulsifying the fat. Okay, so this emulsification of the fat is exactly as you could see. I try to pass 20 times from one side to one side. If you really want to know more about SNIE, about SNIF indications, about the treatment of these, please, you can visit San Diego Arts Academy. There is a course which I have there from A to Z, everything you should know, how we deal with microfat, with a SNIF, with a SNIE. But this course is only about nanofat, the webinar today. So I've passed them 30 times with the pink one, with the blue one, and with the green one. And after this, you could see the difference of colors between microfat and SNIE, which is sharp needle intradermal fat grafting, which is emulsified fat. So as you could see here, this is the transporter to create nanofat. So we have a double layer net inside of this transporter, and I will be passing the SNIE, the emulsified fat, to change it to nanofat. If I pass it through this, it will stuck all the fat cells in the upper part, and the nanofat, these adipose-derived stem cells, we will have in the lower part. Okay, this is the adipose-derived stem cells. Okay, so this is what we call nanofat. Okay, so after this, we will proceed to really go for the face. As you could see here, I will open the transporter, and if I open it, you will find a net, and this is the net. You could see here all the stacks, fat cells and fibrous tissue and everything that we have. Okay, now we have the nanofat prepared. We will start preparing 1 cc to inject them in the face. Okay, so we prepare all the 1 cc's needles to start injecting quickly in the face. Great. So after this, we'll start injecting on the face, area by area. And since it's nanofat, we're injecting intradermal injection. You should see bulbs everywhere in the face, and we start injecting all the face. Okay. So this is how we go fast with it. And as you see, I'm injecting. You should really leave bumps there in the face, and you should inject it very superficially because the mission is to really improve skin improvement. We really need to inject superficially. We should see a yellowish bulbish effect on the skin. If you don't see this, then you're very deep, then less effect you will have on the skin texture finally. So after injecting this, so this is how the patient face would follow after injection. Okay, this is full face rejuvenation. Okay, this is nanofat for skin rejuvenation. Okay, and regarding things which are important, they made a systematic review of safety and effectiveness of PRP for skin, and we usually can, as you know, PRP is also important. You can really mix PRP with nanofat. And this is how we mix them. You can mix PRP with nanofat if you want, and give additional growth factors to it if you want. But as you know, nanofat is much better than PRP 100 times. It's because of the adipose-derived stem cells. But if you want to add some growth factors, you can add. Why not? So indication for nanofat is for dark circles. So as you see, we injected nanofat with cannula, but I've seen that injecting also nanofat, you should inject it with needles. So because I've seen that if you inject under the skin, it's totally different if you inject intradermally. Okay, with cannula, you're not injecting technically intradermally.
Patient has anesthesia.
I should really push.
After doing with a cannula,
I should push inside really to create this yellowish effect under the skin of all the dark circles. And technically, I prefer to inject with needle after I inject with cannula. Okay, for hair indication, you can inject nanofat. You can inject nanofat for hair indication, as you could see, as if you are injecting PRP. Also, you can inject nanofat for scars and to improve the quality of the skin. And for sure, the best is emulsified fat and some SNIF if they are a bit deep. Okay, so I use these two. And I published an article in 2020 regarding nanofat in facial rejuvenation, a step-by-step procedure patient evaluation and recovery process. And the issue is that many surgeons worldwide have been seeing the technique on YouTube, and they went and they did it. And what happens after 2 weeks, they still have some bumps on their faces. They were very worried, and they became everyone text me about, hey, when they disappear, the bumps, since you're injecting these bumps very superficially intradermal, and they were so upset with this. And finally, as you could see, the average time to disappear was 3.6 weeks. You can get the article in the American Journal of Cosmetic Surgery. We have found that there is a patient smoothness of the skin felt in 100%. Patients reported improvement in wrinkles, improvement in pore size, little part, and improvement in redness and rosacea. But the patients were satisfied, and all the patients' bumps have disappeared 100%. The maximum long time was 3 months for a patient. I don't know why some people take much more time and other less. So indications is in rejuvenation, scars, dark circles, and hair loss. And as I said, this is before the treatment, and this is after 10 minutes, 1 week post-treatment of NanoFat, 2 weeks, as you see, the bumps are still there, 3 weeks, the bumps are still there. At 4 weeks, some areas, the bumps are still there. We have been seeing that mobile areas has less, they disappear faster. Non-mobile areas, the bump stays more time, and it's published in the article. And this is how it's after 40 cc's of NanoFat after one session. Improvement in skin quality could be seen for this patient. She managed to feel, technically you can't feel it so much, but the patient can refer it to you. And this is another patient which I did NanoFat and PRP for her skin. 6 months after the treatment, I did SNIE also for her. For dark circles, reducing tear trough and dark circles. Sometimes it's very hard to really detect it, but patients are happy after one session. They can report to you that they have seen some improvement. Technically, I can see improvement from here to here. And this is another patient which I did Microfat and Nanofat. Improvement in the pigmentation, could say, improvement in the dark circles, and technically she was so happy with this. For hair loss, I ejected 3 sessions in this patient. I've seen like improvement, dramatic improvement in it. For sure, they should maintain their treatments, because as you know, hair loss is something. This is a dentist, which I did on him for hair loss too. For scars, I did SNIE and NanoFat. You could see how the improvement. For sure, this is one session. They may require more. He may require a bit also of SNIF in some areas. For scars, NanoFat, the redness, improvement in quality of the scar, it's like magic for me. I've said, as I told you. This is another patient which she had some scars here, only one session. I'm showing one session. Later, I will show you patients with more sessions. But with one session, see there's improvement in the quality of some scars. I injected SNIF, SNIE, and NanoFat in one session. This is a patient where she had a permanent material in her face. Then the surgeon did a surgery for her. He left her with this scar, middle lamella scar, and she didn't want to proceed again with surgery. She wanted to fill a bit this. So she wanted to do fillers, but there was so difficult to dissect here or inject any filler. So I used the tongue snake to cut all the fibrous tissue formation in the deep to liberate. So, and then I tried to inject with the cannula. And this is after only one session of Microfat, SNIF, SNIE, and NanoFat for the area. For sure, they require more. See the improvement of the conjunctival show. This is a patient which she came with silicone infection, and after silicone infection, I did for her 3 sessions of Microfat, SNIF, SNIE, and NanoFat, and the infection get abscess, and the abscess get. This is from the other side. She had a huge dramatic hole. I mean, you can't exactly see the difference. In person is much more dramatic. She had really a big hole in that area, and after one session, this was her case. After I think this is after 3 sessions, this was how she came, and this is her final result after 12 months of 3 times injecting for her face, Microfat, SNIF, SNIE, and NanoFat. So Microfat was building the deep fat, then SNIF building the intersection, some SNIE emulsified fat for smoothing the areas, and NanoFat for skin rejuvenation and improving in the quality of the skin. she really had a dramatic improvement. That day when I saw, remembered me the day when I read that article about the nanofat and microfat in that Japanese. I said it's impossible to really eliminate some scars. I was really dramatically improved after this result. And this is a patient which he did a rhinoplasty with another surgeon. He had really an infection of the columnar strut and get out. The columnar strut got kicked out of his nose, and finally he left him with this scar. So I really needed to build the scar. So I did on him fat transfer, SNIF, SNIE, and nanofat. And then after this, I did some idolase, which is NDX to reduce redness, And this is the result after, as you see, 2 sessions of fat transfer. He was so happy to improve a lot his scars. So as a conclusion, prejuvenation is an indication for prejuvenation with nanofat, for rejuvenation in people who wants to really get some improvement. For scars, you really need this tongue instrument that I have in the master set, Nabil Fakih master set. It's really an impressive set. It's really so precise. I've never seen it in any other brands to have a small head, so precise head that you can really cut without damaging a lot inside. And it's promising for hair loss. So maybe there's some new treatment modalities in the future that can happen. As I said, I'm mixing nanofat with radiase, and I'm mixing nanofat with PRF, and I think we will get a lot of indications in the future. Thank you so much. If you're not reaching, this is my email. Also, you can follow me on Instagram. We share everyday surgery cases, how we do them, and not only for fat, for all types of surgeries. Thank you.
Thank you, Dr. Nabil. That was a great presentation. And we'd like to start the Q&A session. So, and if any of you missed some of his presentation, don't forget to go to sdarts.com, San Diego Arts, and you can catch more of his presentation online or attend the sdarts.com San Diego Arts Conference here live in San Diego or online. Advanced registration ends January 31st, and you can talk to him, meet him then. But in the meantime, let's move on to our questions. And we'd like to promote Dr. Angelo Pecorelli to panelists so he can initiate and start the questions off. Alexis, is Dr. Pecorelli on?
Yes, he's coming on right now.
Okay.
Hello, everyone.
Hello, Dr. Pecorelli. Thank you for joining us.
Thank you very much. Let's start to the question session immediately with Dr. Nabil. Dr. Nabil, first of all, to thank you and congratulations for your amazing lecture. Once again, it's always different lecture. So we have here a few questions from the audience. So let's start with the first one is Dr. Denise Hernandez. So she talks about the diameter of the cannula that you use to fat harvesting, and as well the diameter of the nano transfers.
Okay, so technically the diameter for a microfat, I use, as I said, Dr. Patrick Tonard harvester, which is, I think it's, for me, they have much more demonstrated by article that it can get more adipose-derived stem cell than the Sorensen one. So that's why I used it in my master set. But it's between 2.1 to 2.4 millimeter multi-perforated cannulas normally to harvest. And the one we have in Tulip is 2.4, okay? And as you see, every one hole is 1 millimeter hole. So this is for harvesting. Regarding injections, we use small injector cannulas. As you see, they have 0.7, 0.9, and 1.2 millimeters.
So it's okay. Thank you, Dr. Nabil. I hope Dr. Hernandez will be satisfied with his question. So the next one, let me read from Dr. Carlos Oaxaca. So why don't take the fat from lower abdomen or waist? So he thinks that it's the tides could be visible, some depressions, if you do the liposuction from that zone. So what's your opinion about it, doctor?
Thank you, Carlos. Carlos is the president of the EPSIN, Plastic Surgery Network which is a really famous society. And thank you, Carlos, for this question. I should tell you that for nanofat, I can use any area that I really need. For sure, we need areas which have more. We have seen that they have more adipose-derived stem cell, which is inner thighs and abdomen for sure. But technically, I'm only taking 40 cc's and from a big area, so I would never had any depression. For sure, you can take the abdomen, but remember something that we're dealing with patients who really sometimes they are businessmen or they are celebrities or whatever. They want to join the next day to be working well. If you really do liposuction from the abdomen, some difficulty in the movement and they can feel a bit pain. But in the lateral thigh, technically the next day you can do whatever you want. People feel much easier for them. But again, as I said, it's a small, we're harvesting very little quantity, so you can find it any place you really want.
So also, Dr. Rabi, if you let me add something to Dr. Carlos Oaxaca, I also found from the tight zone, if you want to make the liposuction from there, it's a thin patient, you can choose to do from both sides. So that's that way you avoid any depression if you want to harvest a little amount more. And the last one,
I never had any depression because I take from a big size. So I take a bit from here, a bit from here, a bit from here. So it's really flattens the area in a way. I'm not focusing in one area and taking in one area. I just put anesthesia in a big area. But again, you can take from the abdomen if you want. There is no problem. Sometimes I do it.
That's good. I also think the same, Dr. Nabil. And if you let me do the last one is from Dr. Khaled El Hali. Of course, great presentation for Dr. Nabil. Do you think thigh or abdomen fat are better for face? I think you already answered that question. But the last one is, what exactly do you use, a microfat or nanofat for tier 2 when you perform a blepharoplasty? I think she talks about that. What kind of fat do you use in this procedure to combine with blepharoplasty if you are using or if you are treating to the tier 2?
So maybe you have seen my presentations about my lower blepharoplasty technique with cantopexy, tooth suspension, muscle suspension, which I'm soon publishing it. It's a smooth transition in the lower part. So technically, mainly I don't use at the same time microfat and blepharoplasty. I usually, because I don't need with this all suspension techniques I do. But technically, if I want to really add, or for some people who after they did blepharoplasty, they want to improve this area more, I'll be injecting under the muscle microfat, okay, little quantity, and sometimes I can inject some nanofat under the skin, or sometimes I injected also some SNIE, emulsified fat with some cannula under the muscle, little part in a way just to smoothen when they have little depressions. And mainly I'm not so fan to inject microfat under my technique of surgery because I do suspension technique, and technically I want to leave it there. Maybe I will inject after a certain time, after 1 year or something. At that time, it's still because I open all the eye, I transpose everything, but yes, I do more nanofat for injection, nanofat for dark circles. Pretty personally, I could see that visually you cannot personally, you could not see it. Maybe you could see in some pictures more, in some pictures less. And I'm very critical regarding this, but the majority of the patients, when I do them, they refer that they have improved. So many patients, I could not find difference, but for my patients, all the one I did, they were pretty happy with what happened with them. And barely if someone is a bit like, okay, a little bit improvement, he can jump for another one. And maybe Dr. Patrick Tournard or Ramon can tell us more about this, their expertise in this, and it could be great to know them. Their answers.
Quite good, doctor, quite good. And if you let me ask the last one, it is a very common question around the world when the beginners are starting to do nanofat grafting. And how much time patients should wait for nanofat outcomes if you are treating dark circles?
I think minimum it's 3 months to 6 months. I always tell my patients with fat grafting is this. I mean, I do a lot fat grafting. So my patients who I choose for fat grafting are normally patients I call the smart patients. We call them in the clinic smart patients because these patients can understand that this is a regenerative and it means a building up. It's not something like magic that you come, you finish. And fat grafting, you put like this cheeks, but there's a percentage that will go and another percentage will stay. So you need smart patients who have reasonable minds to understand do this. And you know, Middle East people, they don't think like this. European people are much more understanding about regeneration, about building up, about future. Middle East want now and pretty now. They don't care about the future. They think they will die tomorrow. So this is something that I'm always telling them, it's an investment. It's an investment in your face. So you have to wait minimum 4 to 6 months, I think, in NanoFat.
Okay, doctor, great. I think it's a great answer. So we're done with the question session, Sashi. So thank you very much, Dr. Nabil, for your amazing lecture. And I think that all the questions are answered in the right way. So just take a switch to Sashi.
Thank you, Dr. Peccarelli. Actually, I wanted to extend the question and answer a little. Dr. Nabil, can you hang on just for a few more questions?
Yes.
Okay. One other question that we have, I think that a lot of people are interested in, and because it is becoming a very popular procedure, is hair restoration. What is your specific protocol for hair restoration?
So normally in Lebanon, we don't have any way to really cryopreserve fat. So technically what I do is exactly, I take some fat, like little quantity, 40 cc's, and do nanofat with them. So technically for hair restoration, what I do is inject 3 sessions of nanofat. So I do 1 nanofat, 1 PRP, 1 nanofat, 1 PRP, 1 nanofat, 1 PRP. This is my way. I mean, if some people cannot afford this as a package, because some people cannot afford, I sell it as a package. Then I do 1 nanofat, then 1 PRP, then he can continue with PRP. And if he cannot more afford it, then I go 1 nanofat, and then 2 months is another nanofat, another 2 months is nanofat. So it depends how much the patient can afford and how much, because as you know, nanofat, it takes me time to do it. It takes me time to prepare it. PRP, it's 10 minutes preparation and you can start injecting. And you cannot charge it too much because it's really something, a treatment to support. And this is something which I always worried about how the patient could pay for that. But again, I reduce the package price to make it affordable, and I can make studies to see the advantage.
Great, thank you. And so one last question. I think you answered this in your presentation, but somebody wanted to know, do you centrifuge your aspirated fat or you sediment it only?
I only sedimented. I don't centrifuge.
Okay, I think that's, we are actually ending a little early, so we could go through a few more questions. During multiple sessions of fat grafting, do you have any methods of storing fat?
Off? Sorry, the question came.
During multiple sessions of fat grafting, do you have any methods of storing fat?
So I don't have any method of storing. So because in Lebanon, we don't have cryopreservation. And I don't know if adipose-derived stem cells could get affected. Maybe the other speakers could tell us more about this. But what I do is exactly whenever I do a construction, imagine a scar. So I wait 3 months and I do the second session. I do wait 3 months and I do another session, because many patients won't hear solutions for them. So I think 3 months, I wait for 3 months for a bit of reabsorption and building up, and then I inject the second session.
Okay, so I'll make this the last question. Everyone knows that, you know, with dark circles, it is difficult to completely get rid of. So can you explain more on your microfat placement in dark circle and the nanofat placement?
Yes, so for nanofat, you have to really know why she has someone dark circles. It could be pigmentation, it could be excess skin, it could be a multiple of things, hereditary, it could be sometimes a lot of veins under it, it's translucent and becomes much like dark circles. In fact, if you want to really help a patient with dark circles, you have to sometimes maybe do some skin resection, plus some nanofat, plus some other issues. For people who are so crazy, they want to improve their dark circles, I just push them with a lot of things so we can really improve their dark circles. But whenever I inject nanofat, I go with a cannula in the lateral hole and just inject subcutaneously nanofat. And this, till now, I did it, but I'm still thinking that injecting nanofat with a needle it's intradermally, you're injecting more intradermally, pushing the nanofat and exactly in the superficial part, creating bumping effect and yellowish effect under the skin. I know that the skin is so thin, that area, that sometimes it's the same injecting with a cannula, it's injecting with a needle. But some people, I could feel that it's not totally, there's a little difference in that. And I do both with needles and with cannulas. For people who have hollowness, I inject under the muscle deep, as if I'm injecting fillers, and I leave there the microfat.
Okay, thank you so much. Okay, we are out of time for questions. Please, everyone, we will follow up with the questions and answers later on. If you can also submit on our tulipmedical.com website, and we can follow up with questions there as well.